How do different medications relieving bladder pain? Imagine trying to soothe a sore muscle or calm a restless nerve. That's similar to how medications work to relieving bladder pain. Different drugs target specific causes of discomfort, whether it's inflammation, nerve sensitivity, muscle spasms, or damage to the bladder lining. The choice of medication depends on what's causing the pain, like interstitial cystitis, bladder pain syndrome, or even bladder issues related to cancer. Non-steroidal anti-inflammatory drugs, known as NSAIDs, like ibuprofen and naproxen, are often used first. They help reduce inflammation in the bladder wall, which can be a source of pain. They do this by blocking enzymes involved in inflammation, providing relief for mild to moderate pain. However, long-term use can sometimes cause stomach issues, so it's important to use them under medical guidance. Tricyclic antidepressants such as amitriptyline are another option. They work by relaxing the bladder muscles and blocking pain signals from reaching the brain. They also influence neurotransmitters like serotonin and norepinephrine, which help modulate pain. These drugs can be helpful for bladder pain syndrome, especially when muscle tension or nerve signals contribute to discomfort. Pentosan polysulfate sodium, often called Elmiron, is the only medication approved by the Food and Drug Administration specifically for interstitial cystitis. It helps restore or protect the bladder's glycosaminoglycan layer, which acts as a barrier to irritants in urine. By repairing this layer, it can reduce bladder wall irritation and pain. It usually takes several months of regular use before noticeable relief appears. Some medications are delivered directly into the bladder through a process called intravesical therapy. For example, dimethyl sulfoxide or DMSO is approved for this purpose. It reduces inflammation, relaxes bladder muscles, and can calm mast cells that contribute to hypersensitivity. Treatment typically involves weekly instillations over several weeks. Lidocaine, a local anesthetic, can also be instilled into the bladder to numb the area temporarily, providing quick relief from pain. Muscle relaxants like diazepam suppositories are used to relax pelvic floor muscles that may be tense or spasming. This relaxation can lessen pain caused by muscle tightness. Antihistamines are also helpful because they block histamine releases, which is involved in allergic or inflammatory responses in the bladder. They can reduce symptoms when inflammation or allergic reactions are part of the problem. Leukotriene receptor antagonists, such as montelukast, target inflammatory mediators called leukotrienes. These substances are found in the bladder tissue of some patients with interstitial cystitis. Blocking leukotrienes may help decrease inflammation and pain, although research is ongoing. Neuromodulators like gabapentin are used to calm nerve hypersensitivity. Originally developed for nerve pain and seizures, gabapentin can help reduce nerve-related bladder pain. Botox injections into the bladder are another option. They inhibit nerve signals and muscle spasms, often providing relief for about 6 months. Other medications include cimetidine, an H2 blocker that reduces stomach acid but may also help with bladder pain by blocking histamine receptors. Sometimes doctors consider alpha blockers or immune-modulating drugs, but evidence for their effectiveness varies. In cases of bladder cancer, pain management can involve some of these medications, but often additional treatments like opioids are used, especially if the cancer has advanced. It's important to remember that each person's experience with bladder pain is unique. Medications are often combined and tailored to the individual to maximize relief while minimizing side effects. Always consult a healthcare professional for proper diagnosis and personalized treatment options. They can help determine the best approach based on your specific condition, ensuring safe and effective pain management. Remember, managing bladder pain is a complex process that benefits from a comprehensive, patient-centered approach.